Welcome to the MCRA Industry Leader Interview series featuring MCRA member Wider Circle. Today, we're joined by MCRA CEO Barry Volin, along with Bill Friedman, the VP of Payer and Provider Engagement at Wider Circle. Bill, thank you for joining Barry and I today.
Thank you for having me. It's a pleasure.
Today's discussion is on leveraging community-based support groups to address social determinants of health and health equity, improve health outcomes, and increase member loyalty. Before we jump into today's discussion, Bill, do you mind sharing a bit about your company, Wider Circle?
Absolutely. So Wider Circle is a public benefit company that was really founded to leverage trust in the community. What we have found through the years is that, members, well, they're just not that responsive when their health plan calls. They're just not that responsive when sometimes their doctor calls. But people really trust what their friends and neighbors say. So Wider Circle was created to leverage those relationships, to build those community relationships. We go into the community, we bring members together, we guide them to proper utilization, we help companies address HEDIS measures with their membership. And we build this community around the member. So maybe the hour a week that they spend with us, they have that, specific relationship with that facilitator of ours, but it carries into the community. So, later that week when that member needs a light bulb change, they now have a friend. And obviously, social isolation and loneliness, all things we address that have a tremendous impact, a downstream impact on healthcare.
Interesting. Bill, I've often considered the community as a grossly underutilized resource for the more traditional provider networks in managed care companies. For the most part, the companies focus on their regulatory required provider network, looking at access and availability. How do you vision your community network supplementing and enhancing our ability to provide and optimize our service provision to members?
Thanks, Barry. As part of our program, we get data from our healthcare partners. We're getting claims, we're getting eligibility, and then we're looking into that data and we're finding and building cohorts of opportunity. Who hasn't had their annual wellness visit? Who has not had a preventative care screening? Who has not had a vaccination? Who might be lonely and socially isolated? So we take that data, we build these cohorts based somewhat on age, somewhat on geography. We build them hyper-local, but we also build them based on comorbidities and who is likely to become friends organically. Our facilitators live in the communities that we work. They're familiar with the local customs, the local language. We want members to go to our meetings, whether they be virtual or whether they be on site. And we try and emphasize the on site. Let's get people out. Let's make those connections. We want them to see people that live on their block, that shop in the same supermarket, go to the same pharmacy, the same house of worship. And once we are able to build those connections, then if you need your member scheduled for an annual wellness visit, if you need to address a HEDIS measure, we then have that member's trust. We have that regular, consistent communication with that member. So these circles become this communication resource for a plan. Downstream of that, as these circles start to build and become cohesive units and members start to build these lasting relationships, we have a tremendous impact, not just on the clinical, not just on those HEDIS measures, not just on star ratings, but on retention. Because once members are coming to our meetings and they have friends in our meetings, then if they leave your health plan, they have to leave our meeting. So it becomes a really nice way of giving each member a big hug and making them part of your family, your brand family. Another thing that we do to really exponentially grow the impact of the program is we have what we call our ambassador program. So yes, we have our trained, vetted, background checked facilitators that live in the community, but we also have what we call our ambassador network. That's your members who become brand ambassadors for you. They are trained, they go through a training program, they get a certificate at the end of it. And it is a way of giving members that have the time, that want their voice heard, that are active in their community. It's a way of giving them a voice. It's a way of giving them a purpose in life. So we get folks out that have purpose now, they're in their community, they become brand ambassadors for you, and this starts to grow these circles of trust. And the fact is, once we have a member's trust, then we can do anything. Because when we're calling that member, when we're reaching out to that member, it's not a robocall. It is not a call center or a random call center person leaving a message on their answering machine. It's somebody they have an ongoing relationship with.
Oh, so I'm going to put on my skeptic hat for the moment. And I heard you use words like trust and loyalty, retention, things like satisfaction. And there are many organizations out there that use the same type of descriptors, hyperbole and so forth. Why is Wider Circle different than the others?
Yeah, great question, Barry. There's lots of reasons that we're different. I would say number one overall is the rigor of our data. I come from the health plan world originally, so I know that at the end of the day, when I am bringing a new solution to a payer, at some point, I'm going to have to go in front of my CFO and have to justify the cost. How does this move the needle? What is the impact? What is the return on the investment? So Wider Circle has built into our DNA measuring our impact. So I mentioned earlier, we get claims, we get eligibility, we build a baseline, and then we measure everything we do. We do that through retrospective cohort studies with propensity matching with a really tight caliper. That means that if there is 3 people in this zip code that are male that have diabetes in a study group, we have 3 people that are male in this zip code that have diabetes in the control group. And we do this in an actuarially validated numbers, right? 500, 700, 800 members in these case studies. So we create a baseline, we measure a difference of differences, and therefore we can, with a degree of certainty, deliver the impact. And some of these impacts are, really significant. The other thing is that, we were so confident in the rigor of our data that we brought in an actuarial firm. We brought in Milliman, probably the country's most trusted actuary, to do a methodology review of our work. And Milliman, certainly concurred with that, and we have that report available. And they probably gave us the ultimate compliment you can get from an actuary. And as I always like to say to people, if you go on a date with an actuary and they tell you you're reasonable and appropriate at the end of the date, then you've done great. And that is what they told us.
Let me press that just one step further. Would you feel comfortable in sharing any of the results you've seen that have been validated?
Absolutely, Barry. We have seen increases and really, incredible measurements in member engagement, about a 15% average in DSNP, some states as high as 22% of members involved in engaging with Wider Circle, 36% reduction in member attrition relative to a control group, 14 less hospital admissions per 1,000 members. So, and on and on and on. We see this really across the board. All of this data, Barry, is available to your members, to really anyone that's interested in. If they message us, we have white papers, we have actual peer-reviewed studies, and also that Milliman paper that we spoke about earlier.
Thank you. Appreciate that. That was it's very refreshing to see an organization like yours that is so entrenched in data validation. Most of the time, most organizations have very little data to support their value proposition. In your case, it's very refreshing.
Thank you. I very much appreciate that.
I don't have any other questions unless you want to add anything, Bill.
No, just thank you for the opportunity, and we look forward to speaking to your members.
That's great. Thank you, Bill, for sharing with us today. As Bill mentioned, the reports and white papers are available. If you would like to have access to that, you can complete the form that's on the site that's listed on the screen right now. But Bill, thank you again for sharing with us today and sharing your expertise that Wider Circle brings. This discussion on leveraging community-based support groups to address social determinants of health and health equity, improve health outcomes, and increase member loyalty was really relevant and timely to our managed care community. For anyone else who wants to know more about Wider Circle and the services they provide, please feel free to visit the website that is on the screen for more information. And to all of our viewers, be sure to tune in again for another MCRA Industry Leader interview coming soon.